everyone, I'm Delicia Thompson, and today I'm going to be talking to you about my healthcare topic, measles. So defining measles is a serious viral infection for children, but is very preventable by a vaccine. Not only children can get it, but adults can get it, or anyone who is in contact with the virus, in contact with the infection. It is very contagious, and it starts off as flu-like symptoms, but then it goes into a total of body rashes. So signs and symptoms of measles: hacking cough, runny nose, high fever, red eyes, and kids will have Koplik spots, which are located in the mouth, and they're red little sores all in their mouth, with white centers, blue-white centers, kind of like in their mouth, and of course you break out in rashes. What is happening? Every year in the U.S., over 500,000 cases were reported. 500 people died, and more than 4,000 people developed encephalitis, which is the inflammation and the swelling, of the brain caused by an infection. What has happened? In 2017, it was reported that 118 people had measles. After the first 4 months of 2018, it was reported that 63 people had measles. Why did this happen? How do measles occur? Measles can occur from direct contact, or when people breathe in the virus-infected fluid. Also, it can spread through air, droplets of air. So if someone sneezes or coughs, it spreads out into the air, and it's very contagious. So also, if you talk to a person, then you can get it as well, because it's highly contagious. Also, you can get it from just touching the surface. So if someone was to sneeze or cough or whatever on the surface, and somebody goes back and touches it, you can get it as well. So direct contact of an object or whatever that has been infected with measles. Who is involved or impact? Infants who are not able to get the vaccines. So infants, they're only allowed to get the vaccine when they're 10 to 12 months. Also pregnant women, people with poor nutrition, and people with weak immune systems. So like elderly, they have a very weak immune system, and most people who have weak immune systems are very highly to get infectious diseases and get sick easily. How might society be affected? Many deaths if not vaccinated. Many people untreated because they either can't be vaccinated, such as newborns and pregnant women. More cases of measles. So measles is very contagious, which means if people are not getting vaccinated, it's more cases of people getting measles. And widespread because it's very contagious, once again, and people are requiring more checkups. So the more people are hearing about people getting measles and it's spreading and it's very contagious, people are asking their doctor to be checked up and requiring more checkups. How might the environment be infected? So it's highly contagious, many spreading of measles through the air and surfaces, and many people could be likely to catch it. So the environment, once again, highly contagious. So if there's too many people catching measles, it can be very infected, and everybody can start getting affected with measles as well. How will healthcare systems be affected? More people wanting to be checked for measles, more vaccinations, and can become a contagious setting if not disinfected properly. So if you have patients coming in that has measles and they're sitting in the healthcare setting, the whole place can be affected if not disinfected properly and making it a safe environment for others. What does all this mean for nurses and healthcare other professionals? They should be able to point out signs automatically for measles. So when their patient comes in and they have measles, they should be able to point out the signs and symptoms of it. Also making sure that their healthcare setting is non-contagious, so safe, and they might be required to take vaccines. So saying if they have a patient comes in and they have measles, you've been contacted with that person, with your patient who has measles, so they might be required to take the vaccine as well, so that it won't require them to spread it to other patients who don't have the measles. And that is it for my presentation. Thank you.